Good evening. My name is Ernest Clayton, and today I will be presenting an evidence based intervention. Will often hear me refer to it as an EBI that addresses a critical issue within the Black community, specifically with mental health. My presentation focuses on the Black Man's Health Project, a culturally tailored intervention designed to improve mental health outcomes among Black and African American men. Additionally, I will highlight how this interaction fits into the broader context of my research. So, let's begin. So, what is an evidence based intervention? So, research shows that evidence based interventions is grounded in research and data, utilizes theoretical frameworks to guide implementation. They're designed to address specific populations or health concerns, and it ensures resources are directed towards strategies with measurable success. For the population of focus for this intervention is Black and African American men aged 19 and older. Mental health concerns in this group are significant due to systemic barriers such as stigma, lack of access to culturally competent care, and societal pressures. Black men are disproportionately less likely to seek mental health services compared to other groups, often due to mistrust in the healthcare system and stigma surrounding mental health discussions. This creates a cycle of unaddressed mental health concerns, negatively impacting overall well being, family stability, and community health. Addressing these barriers is critical to improving outcomes for this underdeserved population. So, with the Black Men's Health Project, with this EBI, this is um, an intervention that can be coupled with a lot of theoretical frameworks, but specifically for my target population as I introduce them, this is a faith based, community driven initiative tailored to the mental health needs of Black and African American men. It leverages trusted networks such as churches, barbershops, and other community spaces to engage participants in meaningful conversations about mental health. This program educates participants, reduces stigma, and connects individuals to culturally relevant mental health resources. As an evidence based intervention, it incorporates proven methods like needs assessments, structured workshops, and theoretical frameworks to guide this approach. The goal is to increase mental health literacy, encourage early screenings, and create a safe environment for discussing mental health. So, taking a look at the theoretic frameworks. By using culturally relevant strategies, the Black Men's Health Project meets the unique needs of this population while breaking down stigma. It empowers participants to take charge of their mental health in a supportive and familiar setting. For the theoretical framework to continuously cultivate on top of that, the theoretical foundation of this intervention is critical to its success. It draws three key methods on three different models. We have the health belief model, which helps address perceived barriers and benefits to seeking mental health care. Then we have the social cognitive theory model. It emphasizes the role of community leaders and peers in encouraging positive mental health barriers. And then we have the trans theoretical model, often referred to as TTM. It supports and participates as they progress through stages of change from recognizing mental health concerns to actively seeking care. These frameworks provide a structured approach to effectively engage participants and ensure lasting behavioral change. When incorporating these theoretical frameworks, it is good to know how the cultural relevance of the Black and African American male experience is influenced by a lot of these supportive contrasts. With regards to social cognitive theory, We look at behaviors and look at how it is modeled by peer support. Within the Black and African American communities, a lot of things that are taking place is based upon how support looks to them and how it can actually impact a behavioral change. Now, let's look at how the intervention is implemented. Let's talk about how the program begins with a Black man's mental health survey to assess participants' needs and barriers. The data collected informs the designs of workshops and resources tailored to the group. Using a hybrid approach, the program offers both virtual tools and in person workshops hosted by faith based organizations and community hubs. So, a lot of times in these workshops, they are covered with topics such as recognizing symptoms of mental health distress, stress management and positive coping mechanisms, being aware of negative coping mechanisms, accessing culturally competent therapy and support. Additionally, community ambassadors such as celebrity or influential members in the Black community play a key role in promoting the program, which reduces stigma and encourages participation. So, if we take a look at evaluation and outcomes, evaluating this interaction is essential for measuring its impacts. So, the key metrics include increase in mental health services and utilization, a reduction in perceived stigma measured through pre and post intervention surveys, also improvements in participants' mental health knowledge and coping skills. The program also collects qualitative feedback from participants to continuously refine its methods. Early results have been promising, showing greater willingness to seek care and improve mental health literacy among participants. So there is evidence of success within this EBI. So I would also like to just bring some other evidence based interventions that I typically use within my research. Some particularly that influence different demographics within the Black and Brown communities. I often use the Young Men's Health Project, which targets younger populations to establish healthy behaviors early within their intervention. Think twice and project style. This is an EBI that promotes lifestyle and behavioral change. We also have the barbershop intervention, which uses barbershops as a place for facilitation. We also can use this to address health issues like hypertension and colorectal cancer screening. We use the Wellness for African Americans through churches, which is all. The acronym for that is WATCH. We have Lotto to Link. We have REACH, which stands for Racial and Ethnic Approaches to Community Health. And one of the last one that I will mention is called Power, which is empowering community through health education. While each of these interventions play a unique role, my primary focus is on the Black Man's Health Project because its comprehensive approach to mental health and its potential to create sustainable change. So if we look at it with bringing a conclusion in closing, the Black Man's Health Project is a culturally competent, evidence based intervention with the potential to transform mental health outcomes for Black and African American men by addressing stigma and building trust through community engagement. This program empowers individuals to prioritize their mental health and well being. Looking ahead, this model could be expanded to include other trusted networks such as fraternities, which often in the Black community we refer to a lot of these fraternities as part of the Divine Nine, sports organizations, and scale to other populations facing similar disparities. The ultimate goal is to create a sustainable, community driven approach for mental health care. So, in closing, I would like to say thank you for your time and attention, and I hope this presentation highlights the importance of culturally tailored intervention in addressing mental health disparities. I'm happy to answer any questions. Please feel free to send me an email. Thank you.